Now, Dr. Goodhart started teaching these techniques, and there were all kinds of techniques he developed within the field of applied kinesiology, and focused teaching mostly to chiropractors and medical doctors. One of his early students, Dr. John Thie, who was very excited about this work and would follow him and take all his trainings, at one point said to Dr. Goodhart, "You know, these techniques are actually pretty simple. All we're doing is pushing on muscles, rubbing points." He says, "You really don't have to be a doctor, a medical doctor, or a chiropractor to use these techniques. It's really simple enough that, you know, a mom could use it, you know, to help her child, that anybody could learn, even children." And so he suggested to Dr. Goodhart that maybe we should make this available for everybody. Dr. Thie, because he realized if you're going to start with teaching lay people who don't know anything about the anatomy or anything about how the body works, that he would have to start basically taking people from scratch, learning the muscles on a very simple basis, and also make the system more systematic rather than just a lot of different techniques. He systematized the field of kinesiology, which I think was a great contribution that Dr. Thie brought. We do what we call in the Touch for Health 1 a basic balance, which is balancing a minimum of one muscle for each meridian. There's 14 major meridians. And so as you're balancing up the major muscles, you're actually also balancing up the body's acupuncture system. And at one point, as Dr. Thie was teaching this over the years, he and my teacher, who teaches the practitioner training, Dr. Du, realized that they were getting far superior results than a lot of the other practitioners. And so Dr. Du literally went to Dr. Thie's clinic in Pasadena, California for a week and just paid attention to how he practiced. And what he realized was that both he and Dr. Thie were inadvertently setting a goal with their patients. He would say to them, "So, what's not feeling so good today, and how would you like to feel different when we get done with the session?" And then people would say, "Well, you know, my neck's not doing so good." And Dr. Thie would say, "So, you want to be able to move with greater ease?" And the patient would say, "Yeah, that would be a great thing." Or, "I can't quite bend over." "So, great, you'd like to have a little more flexibility and range of motion." So they were setting a goal, and when you do that energetically, the body is organized in relation to that goal. And so at some point during the last 30 years of Touch for Health, what we've recognized is that our intention and setting goals helps to organize the energy field into specific energetic patterns. And so even though a person may be what we call balanced 1 minute, if they start thinking about the big project they have to do when they get home and they're not looking forward to it, and they think about, "Oh my, you know, this is really something I really don't want to have to do," then their body goes into an energetic stress pattern in relation to that issue. And so in Touch for Health, what we do is we don't just go through and kind of test a lot of different muscles for no reason. We actually do it in the context of setting a goal and then balancing the body in relation to that goal. And when you do that, you can balance people for all kinds of things, not just physical things, and not just for things necessarily that are presenting in the present. So that's a little bit different than what they had been doing in applied kinesiology, which is just learning lots and lots of techniques. So Dr. Thie really brought that system of Touch for Health into a more organized fashion, which I really appreciate. We had the great pleasure, actually, of having Dr. Goodhart and Dr. Thie here in our area last year. My husband and I organized the 30th National Touch for Health Conference in Durham, North Carolina. And we gave Dr. Goodhart a Lifetime Achievement Award. And we had all the main founders and teachers in the field of kinesiology here. We had over almost 300 people from 18 countries. And we were so blessed to have the gathering because just shortly after the conference, Dr. Thie passed away. He had bone cancer, prostate cancer that had metastasized. So we feel like it was a great gift of sort of a going away party to bring him together back with his original teacher and so many of the people in kinesiology who have really taken the field and gone to many places, both literally all around the world as well as in different formats. Touch for Health was sort of the original kinesiology after applied kinesiology. It was the first that was developed for lay people. And then there were other fields of kinesiologies that have sprung out since then, such as Educate, educational kinesiology, which is developed by Paul Dennison, which focuses a lot with initially helping children with learning disabilities. And it's been used very effectively in schools. One Brain, or 3-in-1 Concepts, was developed by Gordon Stokes, who was originally a Touch for Health trainer. He was one of my original teachers. And he developed a whole series of classes. There's transformational kinesiology, there's body talk. I mean, there's all kinds of kinesiologies out there right now. The professional kinesiology practitioner training by Dr. Dew in New Zealand is the first governmentally approved kinesiology training program in the world that you can literally get a degree from. Practitioners over there can get a degree equivalent to a chiropractic or naturopathic degree. So that gives you a little bit of a background. The Touch for Health book, by the way, has had a few transformations over the years. How many of you have seen what we call affectionately the Green Book? This is the book how it was for many, many years in Touch for Health. And it has pictures, diagrams all nicely laid out of the muscles and the reflex points. They changed the cover at one point to make a red edition, so made it a little challenging for those of us that have been teaching it and calling it the Green Book. And then just last year, in 2005, Dr. Thie finally redid it even more so, added a lot more information, made the pictures very nice, added some new information, reformatted the entire book. And this is called Touch for Health, the Complete Edition. I highly recommend for those of you that are interested in learning more about Touch for Health, it's a wonderful resource book. It's been translated into 25 languages. It's been taught in over 100 countries. And in most countries overseas, it's a lot more popular and well-known than it is here in the U.S. So that's a little bit about the background of Touch for Health.